Welcome back. Today we are going to learn about Kawasaki disease, one of the important topic in pediatrics. Okay, Kawasaki disease. So it is a medium vessel vasculitis, also called as mucocutaneous lymph node syndrome, seen in under 5 age of children. It is seen only in children. Then it is due to anti-endothelial antibodies. So the gene involved is ITPKC. You can see the full form. Pause the video. Write it down the full form. Okay. Then we have clinically three phases. It is acute, subacute, convalescent. Then these are the clinical features, clinical manifestation, which involves fever, arthritis, cardiovascular system involvement, which shows myocarditis and aneurysm. Then we have in skin, we have red palm soles, desquamation, then nail changes. In lip and conjunctiva, we have other infections symptoms, then cervical lymphadenopathy, then thrombocytosis. And this the clinical manifestation diagram shows in which particular phase that reaches the maximum manifestation, right? Then coming to diagnostic criteria, presence of fever for at least 5 days which is non-responsive to antibiotic plus any four of the following principal criteria. What are the four principal criteria? Bilateral conjunctival congestion spares the limbus. It's a non-exudative or purulent, not like the bacterial purulent thing. Then we have erythema of oral and pharyngeal mucosa, which shows strawberry tongue. You can see in the image. This is we see like strawberry tongue. It is also seen in some other condition, and it is one of the DD of strawberry tongue. 3 marker, strawberry tongue is a 3 marker separate. You need to know the DD. Polymorphous skin lesion, which is vesicle or bullous lesion absent. Acute edema of hands and feet, erythema of palms and soles. Subacute periungual peeling, desquamation of hands and feet. Then we discussed above that cervical lymphadenopathy, which should be more than 1.5 centimeter, non-suppurative. Usually it will be unilateral. So what are the other affected things? Treatment of Beachy scar, which is typical in Indians, you can see. Then aseptic meningitis, hepatitis, and here CVS earliest feature is myocarditis. Okay, most severe is coronary artery aneurysm. So when it comes to diagnostic thing, you will do 2D echo, echocardiography. So first on the first visit baseline, then after 1 to 2 weeks, then at the 6 to 8 weeks, then 1 year, 4 times we are going to do the 2D echo. Then coming to treatment, you have to give single dose of IV immunoglobulin, which is of 2 gram per kg, with aspirin acts as a anti-inflammatory dose of 50 to 60 mg per kg per day. Okay. Febrile for 48 hours reduce aspirin to antiplatelet drug, which should be like dose of 3 to 5 mg per kg per day. Then again repeat the echo at the 6th to 8th week. Then if normal, stop aspirin. If abnormal, then you need to continue aspirin. So IVIG can be given up to 10 days. If resistant Kawasaki disease is there, we say when it is resistance, presence of fever even 36 hours after giving IVIG, or recurrence of the fever in 7-8 days of giving IVIG. So basically it means even after giving IVIG, fever is recurring. So it is called as IVIG resistant Kawasaki disease. So treatment follows. Second dose of IVIG you need to give, or with predni or infliximab you need to give. Infliximab is a anti-TNF alpha, so then or anacrin. In severe cases you need to go with the cyclosporin or cyclophosphamide. So let's revise quickly. Kawasaki disease, mainly it is a medium vessel vasculitis. Mucocutaneous lymph node syndrome we'll call. Usually it is seen in children below less than 5 years. It is due to anti-endothelial antibodies and the gene involved, and we have 3 phases which involves many manifestations, and this diagram shows in which phase manifestation will be at the max. Then we are done with the diagnostic criteria, which involves fever at least for 5 days, which doesn't respond for antibiotic, and with the four principal criteria, following principal criteria, any one of them. So 4. Then coming to cervical lymphadenopathy, we have clinical manifestation strawberry tongue. Okay, don't forget it. DDs, you need to check up on the DD of the strawberry tongue, which is a 3 marker for undergraduates. Then other effects, treatment of BCG scar, aseptic meningitis. Then in CVS, we saw earliest feature is myocarditis, most severe is coronary artery aneurysm. So you need to do 4 echocardiography with the follow-ups. Then we have a treatment IVIG and aspirin. And coming to resistant cases, you need to go with the other drugs like prednisolone, infliximab, or anacrin. Then we have, in severe cases, you need to give anti-cancer drugs like cyclosporin or cyclophosphamide. Yeah, don't forget to subscribe. Okay, I hope you people enjoyed the video.